Good afternoon, everybody. My name is Larry Kaiser. I'm the Vice President of Marketing at Optimum Healthcare IT. We appreciate you joining our webinar today on anticipating the impacts of implementing a new EHR or optimizing a current EHR. Our presenter today is Rebecca Manning. Becky has 40 plus years of clinical nursing experience, both inpatient and outpatient, and over 13 years of experience in healthcare IT technology, managing large projects, EHR implementation, optimization, training, and go live. Today she's going to go through this presentation and give you some good information, good knowledge. At this time, everybody is muted. Should you have any questions, please use the questions section of the GoToWebinar sidebar panel. Any of those questions we will gladly go over at the end. We've left plenty of time for questions. So with that, I will pass this over to Becky and allow her to start the presentation. Becky, take it away.
Thanks so much, Larry. Hello, everyone. Good morning or afternoon, based on where you are today in the country. My name, as Larry said, is Becky Manning, and I am very excited to share information with you regarding implementing or optimizing your EHRs, or if you're starting the journey, or if you have your EHR in place and you're trying to optimize. What are those key steps and anticipating those impacts? So we'll go through this, and please, if you can ping, Larry's monitoring the questions. If you are not able to hear me well enough, please ping, and Larry can give me the cue to speak louder if you're not able to hear. So today, our introduction and goals, basically where we're at in the goals for today. We want to focus on the key considerations for both the initial EHR implementation. So if you are just now starting that journey, there are organizations, I've had the opportunity to speak to several over the course of the last 6 weeks or so, that are truly moving from paper over to an electronic system. Or if you're already up and running, as I said just a moment ago, and you want to start looking at optimization, what are those things you need to think about? We're going to talk about those key checkpoints that are vital to the success of the implementation and or the optimization. Also, we want to leverage and maximize your teams to ensure success, adoption, and continuous improvements. As it has been my experience over many, many years, and I've had the opportunity now to participate in more than 100 go lives, and there are common themes and threads that run through all, and the keys to success. We're going to go through those here. And best practices to what we want to look forward to as you're starting your journey or optimizing your journey. So if all of you, and I'm sure most of you have read those 7 steps, implementation of an EHR, optimizing an EHR, we're going to start with the end in mind, principle for all those keys to success. When I talk about beginning with the end in mind, there are considerations, and you'll see those here. Planning, your timelines, and communication. Obviously, planning is key. So you want to sit down, and as an organization, as leadership team, you want to look at what is your roadmap, what are your considerations, and really map that out and have a very clear vision for what your roadmap is. As you start your journey, look at what you have from having that end in mind. Where do you want to be at the end of that journey, so to speak? If it's initial implementation, where do you want to be at that initial go live point when you flip the switch initially? If it is an optimization, what is your roadmap for that? What are you trying to optimize? What are the priorities for that optimization? So you want to lay that out so that you can articulate that and communicate that clearly. Coinciding with your roadmap, you definitely need to consider a governance structure. Do you have a governance structure? If it's an initial implementation, you want to look at the structure that you have today and think about how you can leverage that in an EHR implementation plan, a project plan. Are there committees and councils that you can leverage in that governance structure that will serve you well to communicate and have a successful implementation or optimization plan. And when I talk about a governance structure, in your organization today or in practices today, do you have a med exec committee? Do you have a physician advisory committee? Do you have a nursing council? Those are the sorts of councils and governance structure that you want to think about that will coincide and partner with the project team so that this is an operational and organizational change. This cannot just be an IT project, nor can it just be an organizational, meaning an operational project. There must be a partnership between the two, and the governance structures should reflect that partnership. It is always good to look at the standing governance structure that you may have and understand if you can leverage those and have ad hoc key members to those governance committees or councils so you don't have to reinvent the wheel, so to speak. And then looking at your timelines, think about where you want to be at the end of your goal date, your go live date, whether it's implementation, optimization, and look at what your other initiatives are from an organizational standing. Do you have competing initiatives or do you have coinciding initiatives? It is always a good consideration if you have things that are perhaps competing, can you implement those prior to your initial implementation so that that change isn't incorporated within the initial implementation, minimizing the impact of the implementation of the EHR? Or are there coinciding initiatives? Are there things that you need to think about? And we're going to talk about some of those in the next upcoming slides. And then you want to think about what could be implemented in advance. A really good example, and I know many organizations, the majority, already have barcode medication administration. And so if that is something you don't have already, can that be put ahead of your EHR implementation, or is it part and parcel of that? Automatic dispensing systems, if you're changing out Omnicells, Pyxis, MedSelect, those sorts of things, can you do that ahead of the implementation? So there are considerations that you want to think about in that timeline, and what will enhance those optimization efforts. So what can we put in place? Another good example operationally are override pull lists. Where are they? Are they universal? Are they collaborative? Those are the sorts of things from an operational perspective that you want to consider in your timeline, and make sure that you earmark those to have a milestone for those in your timeline. I cannot say enough about the communication piece, and this is critical to the success of your implementation or optimization. You're considering who, and when we're talking about who, we're talking about who is going to actually be impacted by this and who needs to be engaged. Who is our audience? Who is the customer base for this change? How are we going to implement this? What is that project plan? What is that timeline? What is that roadmap? So when you're talking about how, you're going to have to visually show that roadmap and then describe how you're going to achieve your goals for your implementation or optimization. When is always the key question, because there are so many things that come with that when. When meaning, when are we going live? But then as you think about that go live date, and most organizations will begin that message of the go live date is really the beginning, it's not the end. But what has to happen before that go live date? So when will training start? When will things start to change? When will devices be deployed? Perhaps when will those role discussions need to happen? Those sorts of things. And then probably one of the most important things from a communication and change transformation perspective is the why. Why are we doing this? Why are these dollars being spent, the time, energy, etc., being spent on this project? Why is it so important? So those are those key things. And again, when you're thinking of each one of these in your planning phase, looking at your timelines, and in your communication strategies, you want to think about having the end in mind when you describe these to those that are going to be impacted by the change transformation. Those success keys, again, communicating the why. How do we communicate the importance of that? Really need to have passion and a clear vision of why we're doing this. If your key leaders don't have that vision, it's very difficult to communicate that importance to those that have to adopt this change. Again, just spoke about this just a moment ago, communicating the how, laying out that project plan and the key timeline, the key milestones, etc. The when, again, what is that timeline and what are those parts and pieces that need to fall into place so we can keep our project, our EHR implementation or optimization on time and on budget, as well as hitting our date for our go live. Nothing is truly more important than being able to communicate the vision for future state, getting that excitement as to where we're going to be because we've adopted this change, this electronic health record, the optimization of our health record. What is that vision for future state? So I know that all of the, the barriers, perhaps some of the anxieties, the confusion, etc., and going through that timeline, going through that project, because I can see that vision, because my leaders have told me that I can see future state. It really does help with being able to really gain the momentum for the engagement. And it also helps to, from a future state perspective, sharing that ongoing plan for continued improvement. So if it's your initial go live, that isn't the end. And we want to be able to share what we're going to do as an organization once we're live, how we're going to continuously improve. And we're going to obviously relate it all back. As Larry shared with all of you, I am a nurse by background, and I always bring that back to the goal for these types of change transformations in organizations is to better improve the patient and family experience, keeping that at the center as to why this kind of transformation is necessary and why it shows such passion from a leadership perspective. Also, the coworker benefit, the integration of an electronic health record, the seamless documentation, etc. There are huge benefits from a coworker perspective, and then the coworker satisfaction obviously ties into that. Communication, again, as you can tell, communication is key, and why it is so important. We want to talk about the integration of that health record, why we're doing this. Many times it's because our current system is sunsetting, or parts or pieces of our current system or multiple platforms are sunsetting, and there needs to be a solution for that. A single platform, something that plays well with others, so to speak, and then the inefficiencies in the current state. Many times as Optimum leaders, we go out and we speak with clients, and there are just clear inefficiencies in their current state. They have multiple different departments that are working in different platforms, and they're just inefficient. They don't speak to each other, etc. Many of them are niche projects, hybrid projects, and so we want to talk about that and describe why those inefficiencies don't really bring the organization as a whole to where they want to be. And then again, as I just stated earlier, that better patient experience is why many times this is so important, and it allows you from an integrated perspective to really get a completeness of the patient's story, and that's what's so important, so that all of the aspects of a patient's story, our patient's health, is known to us, so those medical decisions are based on real data, and we then provide better care and a better experience, and optimally a better outcome for our patients. If there's one thing that we can always count on, it's the fact that change is constant, and every one of us in healthcare and any other industry knows that change is constant. You can bet on it, and in an electronic health record implementation, optimization, that is absolutely true. So the part of that we need to understand is we need to understand and anticipate the barriers to the project. Every person adopts and adapts to change at different paces and different rates. Many adapt very easily, and others are very reticent to adopt what is going to be changing in their world. Much of it is driven by anxieties, or perhaps sometimes fear. Is my job still going to be secure? So that communication based on what those barriers might be, whether it is personnel, your coworker base, whether it is technology based, what are those barriers? What is your real estate, the building that you live in? Are there barriers there? So really need to communicate those barriers and understand that, and how we're going to be able to walk through that change transformation through the course of the timeline. A communication plan is vital for the success of any implementation or optimization, as well as continuous improvement. I can't speak enough about that communication plan and a dedicated group of individuals that is their priority, that they listen to their senior leaders and develop that communication plan that is consistent across all those that will be impacted by an EHR implementation or optimization. The key question, who should communicate and when should they communicate? That is very important. And one thing that is been proven true across the board is that the #1 success factor for managing change, and clearly an EHR implementation or optimization is change, it is transformation, is visible and active executive sponsorship. I cannot talk enough about that. This visible and active executive sponsorship is not something that is video recorded on a one-time basis, and that's the last we see of those executives. It needs to be consistent, it needs to be constant, and it needs to be felt basically through your organization, so that basically every co-worker in your organization can articulate the vision. They may or may not agree with the vision, but they're able to communicate it, and it means something to co-workers when those at the very top are talking about it, they're walking the walk, they're talking the talk. This is very key, and I have worked with organizations where, for a variety of reasons, this hasn't been executed on as best it could. And I will tell you, the impact of that is real. So I would encourage any of you that are going to be going down the journey of an implementation or optimization to really encourage and pull together, if you're part of that executive group or you have those relationships, pull together that communication plan with executive sponsorship. Now let's talk about those keys to communication and change transformation. There are business project change principles, and then there are personal change principles. And the communication and sustained involvement really does validate the vision and the goal of your implementation or optimization. And those communication points allow for those basic steps in change management. From a person-to-person coworker base, that executive sponsorship wants to be able to communicate and allow for an awareness of the project. Awareness of the project, and for the coworker base to really understand and get the vision, the future state, the passion for that future state, and the possibilities of where the organization is able to go, really does then begin those initial steps of engagement. So you're looking at your communication plan, you're providing that awareness of the project consistently and constantly. Then you start building onto that engagement. What does that mean? What are our workflows going to look like, etc.? And so that engagement step really does align with your readiness plan, and we're going to talk about that in just a moment. Then you're going to step into, as we understand we're working through this and we are engaged, and what are those workflows going to be like? Then we move into that training piece, education to prepare for that change, for that day when the switch is flipped. Going to require practice. We need to practice those skills. And I know most of you that have already gone live and are looking at optimization, you felt in that early stages of your initial implementation, you realized how valuable those practice sessions were, whether it was a dress rehearsal or practice labs, so forth. So practice is vital to either an implementation initially or optimization. You in particular want to develop policies and procedures that support that future state. And then you want to plan for the future while you're maintaining the integrity of validated build. And that part really does speak to, that last point really does speak more to the optimization piece, because while you are in your steady state and you're looking forward to optimization, you really have to be very conscious about change control and communication strategies so that your current state stays whole until you move forward in that optimization. All right, so let's talk about that adoption and optimization. Implementation, the implementation step, is the ability to effectively communicate the plan, and it really does enhance the speed of team buy-in, and that's what you want. You want folks to get encouraged, excited, so they kind of raise their hand and say, hey, listen, I want to participate. I want to make sure that my department is represented well, and we are really going to engage and adopt and really take it to the next level in our department when we implement this. The preparation adoption is key. So enhancing the ability to stabilize and prioritize what those next steps are. And again, as you can see, that theme here is you want to begin with the end in mind. So as I'm preparing and adopting, that allows me to say, this is where we're going to start with that initial implementation. And then I can look forward to prioritizing where I want to be. Is it 30 days after our initial implementation? Is it 60? Is it 90? So forth and so on. We can't really move forward in a next step or an optimization piece until we get stabilized, and that's really important. So you've communicated your plan, you've worked through all of those readiness pieces, folks have gone to training, they've practiced, you are now in your stabilization piece. So we know that all of your coworker base really feels comfortable with their new tools. And that then allows you to really look at and plan for what the next steps are. I encourage all of you that are perhaps on your initial implementation journey, don't be quick to change things too quickly. Be very deliberate and be very considerate of what those initial reactions are to, gosh, I really don't like this. Oh, could you change that from that coworker base? Be very clear on where you really want to be. So we want to make sure that based on the overall picture, what makes the most sense organizationally, so that you can tie that back to your original goals of your project and then line out and prioritize your next steps. With those next steps and the criticality of where you might be with issues, etc., that will then lead into the optimization piece. And that is where readiness is so key here in optimization. So when you're initially going live, or if you're going live in phases, or you're optimizing, that readiness piece is very important and critical in setting up how you're going to report your issues, what your metrics are going to be, what types of reports do you want to see that allows you to really leverage, as you can see here, leverage real data to prioritize those optimization efforts. Leverage the data that gives you the black and white objective metrics on your organization, not necessarily just how it feels to someone. And I will tell you, many times in my experiences and others that have worked with me in our teams, sometimes folks will say it takes longer, it feels like. So let's get away from that and let's look at the real data. Look at your issue management system. What is it telling you? What is the acuity and the criticality of your issues that are logged in your system? And can you bucket those to really look at prioritizing your optimization? In the early days of EHR implementations, many times those priorities were more centered around patient movement. And that's where the criticalities were really listed. And so I think from an organizational readiness perspective, a lot more attention is spent on that. Now it's more sometimes revenue based. Was there a gap in training, etc.? So looking at those issues that are logged in your system and the criticality of them, and is there a common theme, really does allow you to prioritize your optimization efforts. What organizationally do you want to adopt? And then what are those things that you can prioritize from a departmental perspective that might give folks a little more satisfaction, a little more efficiency in what they do and how they do it, that doesn't really need to be governed by the bigger organization. And sometimes that is very true. There are departments that really do need certain things that others do not. So you want to look at that and pay attention to that from an optimization perspective. Things as simple as when I'm filing an issue, do I want to put a naming convention in there so I can truly look at those and filter in my issue system very quickly and get to the ability to prioritize where I want to spend most of my effort from a project team perspective in the optimization part. Continuous improvement, again, if you're to that point, using, again, that real data to hardwire continuous improvement. I spent a good amount of time in my earlier years in barcode medication administration reporting, and this was a number of years ago, and it was very interesting. Something as simple as embracing that barcode medication administration percentage or compliance. And as you set a goal, 95% compliant, all coworkers must barcode their medications 95% of the time or higher. And that, I'm just throwing that out there as a number. And that is the goal. And incorporating that, and when I talk about hardwiring, incorporating that in yearly reviews and having those conversations about why are you less than that number? Why are you more than that number? Other things from a real data, hardwiring those is how long is it taking you to close an encounter? Are you consistently documenting your level of service? There's a number of things that you can truly incorporate and hardwire for that continuous improvement. And keeping in mind that one of the goals of EHR implementations and optimization is, again, to promote patient safety and promote the patient and family experience. And that hardwiring piece and really leveraging that real data is key to that. And that all lives and in your readiness plan and how you're going to execute on that right up front. The checkpoints then, key checkpoints, let's talk about the people. So who are your champions? And this is another one, just like that executive sponsorship as a vital, just critical piece to the success of an implementation or optimization. Your champion base is absolutely part and parcel of that plan. Your champions, your super users, folks call them super users, folks call them a number of different things, but for the purpose of this presentation, we'll just call them super users. Those are your formal and informal leaders in your organization. And when you're talking about an implementation or an optimization, you want to leverage these individuals. You want to be clear about their role. You want to be clear about their responsibility. And you also want to work on retaining these individuals. Numbers of times now we've seen the case where, the super users, that program, so to speak, really has a strong base in the initial implementation, and then post initial go live, that group kind of falls away, filters away, and then when it comes to needing to optimize or looking at some continuous improvement pieces, you weren't able to retain that group. So I really encourage everyone to really look and clearly describe the role and responsibility so that it is very clear and you can retain those individuals. What do they look like? Who are they? Those are those individuals that are committed to your organization, that when that senior sponsor, that senior executive really lines out the vision for this implementation or this initiative, they get it. They understand it. They're passionate about it. They're individuals who aren't really in a job every 2 years. They're from one organization to the other. You want to really look for individuals that are committed to your organization, for all intents and purposes, are there for the long haul, so to speak. And we all know that things come up. Folks get transferred, etc. But you're really looking for those folks that are more of a permanent type of coworker than someone who is transient or really gets their, is more passionate about, the opportunities year to year. So this group they are strong, they're engaged. You want them to be committed, because this group really is your go-forward strategy for success for your organization. If it is your initial implementation, these folks, the super user base, is the group that you will look to say, help us prioritize our optimization. If you're looking at optimization and you've gotten to a place where you feel comfortable your metrics are looking good, your efficiencies are looking good, your provider engagement is looking good, and now you want to look at what is our go forward strategy from a continuous improvement perspective. How do we want to ensure that this super user base is that group that you want to tap into? And so you can see how critical they are to your internal success and your go forward strategy for success. Continuing on with the implementation checkpoints with regard to folks, to people. Healthcare budget constraints, you have to consider that. And does your organization have the capacity to dedicate staff in out of staffing assignments in support of the initial activation? So if you are looking at an initial implementation, I encourage you to look at initially what it's going to take. What is that lift from an internal perspective to have part of your staff out of their day-to-day assignment during that initial activation, that initial 2 to 4 weeks, so to speak? And will you need help with filling that gap so that you can keep your business, take care of patients, etc., going during that initial go live? Continue to do more with less. I know in the early days when I began my practice as a nurse, the times were different. There was a little, I don't want to call it fluff, but there was a little more leniency in staffing models. In today's organizations, the budget doesn't allow for that. The budget doesn't allow for additional folks to be working. You have what you need to take care of your patients or to run your departments, not a whole lot more. So there has to be some flexibility in creating a strong super user group in the weeks prior to activation. And it may be that some of that super user base can't come out of staffing. So how do you support your departments without that model? And that's why that readiness piece is so important. That's why that practice piece is so important. And we're going to talk about some of those things that allow you to engage that group from a readiness perspective. So if in fact you do have budget constraints and you are staffed very slim, so to speak, or you know when your go live date is going to occur, it might be where you traditionally have high census. So we want to look at those because that is where you really want to pay attention to your readiness efforts. So the day of go live or the day of optimization is not such a heavy lift that you are prepared because you've practiced leading up to that. So how do you ready your organization? Again, those readiness events are key to go live confidence and competence. And that's the important part, because as a patient in your facility, in your organization, I want to make sure that as you present to your patient base, you're that same confident and competent clinician or support staff as you were prior to the go live date. And that's so key to how your community looks at your implementation. The technology piece plays a huge part in the readiness. So there are things we want to consider. The current state of inventory, meaning device inventory. So based on the goals of the implementation that were set in that roadmap, in your timeline, what do you have to do from a device and hardware perspective to be able to support a successful go live? So current state, does it meet those goals or not? And then we have to have a plan for that. Have to have a plan for not only procuring and placing those devices, but also ensuring that they are doing what they should do at the day of go live. So there needs to be a targeted assessment of those needs. You need to plan to enhance the availability of devices and peripherals. And by peripherals, I mean, are you going to be adding cameras? Are you going to be adding e-signature pads, barcode medication administration scanners, additional document scanners? What are those things that you need, and have you budgeted for those? And so that is very important. Placement of devices. This I cannot stress enough. Keeping your HIPAA guidelines in mind when you place your devices. Making sure that if you're adding printers, you're adding them where they should be placed. And that is key. When you're adding devices, make certain that there is security around those so that the EHR, the electronic health record, isn't up and running for anyone that walks by to see personal information, PHI. Validation is critical. Is the technology being placed accurately? So when you do your needs assessment and you work with department leaders, there really needs to be a sign-off on where those devices should be placed. They are then placed and validated that it's accurate, dress rehearsed so that the mapping is correct, they're in working order, and then both the technical team as well as the organizational operational department leaders sign off on that technology so that you're set up for success initially prior to go live to really promote efficient documentation, real-time documentation, and you're not hindering the healthcare team in trying to get their work done. From an operational perspective, so we just talked about the technical perspective, let's talk about the operational perspective, campus readiness and facility readiness. The physical campus, is your physical campus aware of all of the increased activity that's going to take place at go live and leading up to go live? All of those readiness activities, the additional folks on the campus, the signage that's going to be present, etc. Something as simple as security being aware of the additional support that's going to be in place. Is food services aware? Is environmental services aware that you're going to be implementing something in that transformational change? And hopefully, going back to one of our very first slides, that vision that was shared, that communication that was shared by that executive sponsorship should also be shared with security, with food services, with environmental services, so everyone feels that they are part and parcel of the success of this and they're ready. The operational changes really need to be key for all team members to understand and adopt those workflow changes. It may not be perfect, but we need to understand if in fact this doesn't feel right to me or an individual team member, why is it that we are changing the workflow in this fashion? Help everyone understand that change. And sometimes it's simply the part of the system works this way for a reason, so this is why the workflow changes. But when your teams understand the why, they are more likely to adopt that workflow change. And then again, I cannot stress this enough, communication on your campuses, in your departments, whether it be through your patient portals, communicating that this type of transformational change is happening to your patients and their families so they understand the change. They can anticipate perhaps in a little bit longer of an experience when they are on site, but they also can embrace the benefits to their overall care experience. The people, from an operational perspective, you want to plan for training, you want to plan for practice, and you want to plan for rehearsals. This is very key. Practicing and practicing and practicing is key to success at go live. It is key to really getting to baseline productivity as quickly as possible. The operational dress rehearsals play a big part in that. Those operational dress rehearsals are basically that opportunity to say, before we go live, do we get it? Does not only the technology work how it's supposed to work, but do our coworker bases all understand what they're doing and what their roles look like? Very, very important. Provider personalization is also at the top of the list from a provider perspective, as well as just the patient experience. Allowing the providers, your physician teams, to have the opportunity pre-go live to be able to go into the system and personalize the new EHR to what they do and how they do it. That allows them on the day of go live to already be able to pull in a lot of those really great things from the EHR, the reasons you selected the EHR for efficiencies, for checklists, to ensuring that all of the mandated documentation is completed, to be able to achieve charge capture, so to speak, to be able to bill for accurately and appropriately. That provider personalization allows the physicians to set that up so that on the day of go live, they start working in the system. And while it may be a little different to them, it looks familiar because they were able to set up those things, such as notes, such as preference lists, Those sorts of things will allow a much more efficient provider experience and obviously then a patient experience. So that part is key in a readiness perspective. From a training perspective, I've worked with many organizations and they do a beautiful job at planning for training. I encourage all of you to look at your training plan and your budget regarding training early and often. Really understand who works for you. And I will tell you, there are many times where we engage with organizations and it's very difficult. And I don't think it's anything that is uncommon, but understanding who truly works for your implementation and how that will impact your implementation initially or your optimization. Not only who works for you, but what are their roles? We want to understand that very clearly so that the training is on the mark the first time. And so developing who works for you helps to understand a plan that is specific to the roles. And that then leads into that fourth bullet point, allows you to set up the logistics for training, communication of how your organization is going to roll out the training plan, communicate the training plan, and then execute on that training plan accordingly. Do we have enough classrooms? Do we have the right equipment in the classrooms? How are folks going to get to classrooms? How are you going to allocate the time that they're spending in class? And what are those policies and procedures around training that are going to be so critical to executing on who completed training and who passed those assessments, so that when you have your go live date, you know that those that are working in a specific role were trained appropriately, have been passed from an assessment perspective as proficient in what they're doing, and know how to do their job in the future state. It is very important to have an evaluation of the effectiveness of your training. It is not uncommon at all. In fact, it's part and parcel of any training program that regardless of how much the training curriculum has been reviewed and it's been looked at and it seems to be on the mark, as you truly execute and have your end users in the training programs, you will see how you need to tweak the training, what you need to add, what might be redundant, etc. And then it will also give everyone an opportunity to say, how effective was this? This evaluation of effectiveness is also key and very important to continue to look at through the initial weeks of go live. And as you see what those common things are that are reported in from an issues perspective, it allows the training team to then kind of remodel their curriculum, so to speak. We're getting a lot of tickets on some particular point of functionality. So we want to go back and look at that part of our curriculum and either really kind of streamline it better, be more effective in our communication, be more effective in our functionality description, etc. And that also then helps you set up for your go forward strategy in steady state training. So what does that mean now after you've gone live to your onboarding, your traditional onboarding, etc.? So that training piece, again, understanding who works for you, developing a plan with the roles that are appropriate, really looking at logistics and communication, and the fact that this training is mandatory for everyone to be able to use the new electronic health record. Very, very critical to the success of a program. So everyone's gotten ready, they've been trained, and now we're talking about activation. And again, even if you're optimizing, there may be some training that needs to occur. So don't think that if you've already implemented, you don't need to go through that readiness step or that training step to go live with an optimization piece or an upgrade piece. Activation is still critical. And some optimizations are more robust than others, and there may be support that's required for optimization pieces or upgrade pieces. The critical part to activation is understanding and hitting the sweet spot in knowing the numbers that are needed for activation support, so that when folks are embracing the new system on the day of go live in those first couple of weeks, the support is there to reinforce the validated workflows. So that learning curve to adoption is key. And if I will tell you that super user base that we spoke of a little bit ago is so important. So the more internal super users you have, the more internal coworkers that are based in departments are key to really shortening that learning curve to adoption. Who are those provider champions? Your leader champions need to be there as well. That executive sponsorship, visible, walking the floors, walking the departments, really championing this new implementation are key to being able to really plan and support the entire scope of the project. There is something that many times is missed, and it's those third-party systems that are still going to be in your electronic health record world, so to speak. So their participation, that vendor participation at Go Live is key. So if something isn't quite talking to your electronic health record appropriately, that immediate action can be taken. And that third-party participation, those vendors are accountable to your implementation leaders to get that corrected while you're in that immediate phase, so that while support is present and on the floors, those workflows can be solidified without the hiccups of a third-party system that might not be speaking to the internal system correctly. So that's really something that I would encourage all of you to think about, is having those groups on site is ideal, depending on how many third parties continue once you roll out your electronic health record. If at a minimum, an open bridge line is always suggested for third-party participation. Once you've gotten over that initial go live, and you by looking at your coworker base and understanding that the majority, if not every person, outstanding would be anyone out on an FMLA or a group of individuals that you know wouldn't have been participating, have used the system, your issues are starting to lessen in being reported, you want to allow time for stabilization. So continue to monitor, are we closing more issues than we're opening? Have the majority of our coworker base interacted with the system and feel confident and competent? And if that is the case, then let's start looking at the issues and look forward to where we want to spend time in optimization. So those are the key pieces from an optimization perspective. And then what do we want to embrace as a continuous improvement perspective? What perhaps traditionally in the old system or previous system, we didn't do so well. So we want to look at optimizing that, and are we getting what we wanted out of the system? And then what do we want to hardwire for continuous improvement? What are those measurable goals for each coworker to achieve to sustain continuous improvement and really improve the patient experience? And then the byproduct of that is coworker retention. If your system is working efficiently and effectively and really helping each coworker feel competent in their role and supported by the EHR, that retention piece becomes a lot easier. This is something I like to talk about for a lot of reasons. The buzzwords, obviously, in the communities is that efficiency. We look at provider efficiency and so forth. Efficiency without the engagement of your super user base, without the engagement of your entire organization and those senior sponsors, as well as effectiveness. Those three components, efficiency, effectiveness, and engagement, is what really leads to that level of excellence, where you have patients that are, they're promoting you in their community. You are promoting folks to come to your organization because of this, because you have a community of end users that are engaged, they're able to work efficiently, and more importantly, they're able to work effectively. And that gives that level of excellence. That's where you see your magnet status organizations, those quality award winners. This demonstrates that you can't have efficiency sit off to the side. You really have to be efficient and effective. And to have those things, you have to be engaged. And that's when you really achieve that level of excellence that we're demonstrating here. So future state, what does it look like? How to maintain the integrity of the goals of implementation and optimization. You have to look at your build. And I cannot encourage enough from the very start, again, thinking of you're starting with the end in mind. When that initial build occurs, looking at trackers, looking at key decisions, and making sure that those remain intact and current. Are they versioned so that when you do look at optimization, you are looking back on build that is actually in production, not old notes or build that wasn't accurate or wasn't efficient, so to speak, or didn't really hit the mark in a workflow. You also want to make sure that the utilization of the system is taking place. So constant rounding, using your super user base to look and say, we are using the system. I had the experience in an organization where in doing some rounding post go live, found out that a department basically said, we're not using the system, and we went back to our old Excel spreadsheet. And so that's not something organizationally that you want to hear as a leadership team. You want to ensure, again, having that open communication, engaging your super users, that not only is the build on the mark, but that the community of end users are actually using the system as it's supposed to be used. They're not using a workaround. They're not something that just works easier, so to speak. So you want to make sure that the utilization of the system that is built and the intended goal of the system is actually being utilized appropriately. And then again, from a future state perspective, the family and patient interaction, you want to make sure that you're preserving that patient and family interaction. And many times, because of an EHR, and that most of the time you're also adding devices and you're adding the ability to engage families and patients in the electronic health record and being able to visualize on the devices what this looks like. You want to make sure that you're allowing that to happen and continuing to embrace that piece, and that will help you to maintain the integrity of the goals organizationally for patient and family satisfaction and coworker satisfaction. Change management is ongoing. As I said initially, there's one thing we can count on. It's the fact that change is constant. So change management doesn't end with go live. It doesn't end with optimization. We flipped the switch or we incorporated that build from an optimization perspective. It's going to continue to go on. And those same goals of the assessment, the desire, the knowledge, the ability, and the reinforcement of that change needs to continue, so that that then aligns with your business project plan. So what was the business need? What was the concept and design that ties back to the build piece? Then we're going to implement, and then that optimization piece to move forward in optimization is that post-implementation status based on real data. And change control moves to steady state, moves to the collaborative decisions. And that change control is very important as you embrace optimization and continuous improvement. The one thing that I cannot stress enough as well is when you, not just when you flip the switch from a go live perspective initially, not when you flip the switch or incorporate your optimized build, do you celebrate success. Celebrate success all the way along the way. It's very important. It's very important for that senior or executive sponsorship to be able to articulate those successes and really continue to keep your entire community of end users, super users, department managers engaged and feeling confident that we are successful, we are meeting our timelines, we are meeting our objectives, and we can continue down this path to a go live, and then we can plan for improvements. We can plan to make this system work even better for us. I know that that was a lot of information, and I think we are at about our time mark. So I would encourage any of you, if you have questions, please feel free. I know Larry's taking those. Please feel free to ask those questions and we can discuss those. We're happy to engage with you either now or we can write you messages, etc. So I will open it up to the floor, and I do appreciate your time.
Thanks, Becky. That was really great content and very educational. So I appreciate the time you put into that presentation for everybody. Again, if you have any questions, feel free to drop them into the questions panel, and I'm happy to get those out loud, and Becky would be happy to answer any of those for you. In the meantime, if you have any interest in learning a little bit more about the services Optum offers in these areas, there are two PDFs in the handout section if you wish to take a look at those and download those. So I will just give it a minute for those that are still on. If anybody has any questions, please do feel free to drop them into the questions panel. All right, it looks like that I'm not getting any questions. So Becky, it sounds like your presentation answered everybody's questions. So thank you everybody for your time. If you do have any additional questions in the future, please feel free to reach out to us through our website. We're happy to answer any questions for you. This webinar will be posted to our website sometime tomorrow if you wish to download it and watch that again. So thank you very much, everybody, for your time. Have a great afternoon, and we look forward to having you on future webinars in the future. Bye-bye.